Hello and welcome to this special webcast brought to you by the Conference Board in partnership with Springbuck on the downstream effects of COVID-19. I'm Robin Erickson, Principal Researcher here at the Conference Board, and it's a pleasure to welcome you all to today's program. Just want to give you a quick overview of today's webcast. First, our presenters will be talking about mission matters, the importance then of health intelligence, then the downstream impacts of COVID-19 in terms of 5 potential shifts that we can anticipate, and then now what, and what are the next steps? And I'm sure you are all as interested as I am in this content, given what we've been going through here in the U.S. in the last 3 months. A couple housekeeping issues. CEU credits are available for those who attend the entirety of the live show. For those who are interested in earning credit, please type your name, email address, and credit type needed in the designated box below. If you wish to earn CPE credit, please also check the 3 pop-up boxes that will appear throughout the program. It is now my pleasure to welcome our Springbuck presenters. Springbuck is a health intelligence platform that works with employers to help present disease with data. And I can't think of a better time to be talking about this than during a global pandemic. First, we'll be hearing from Rod Reason. He's the co-founder and CEO. We'll also be hearing from Dr. Janet Young, who's the lead clinical scientist at Springbuck, as well as from Dennis Schuler, who's an advisory board member of Springbuck. And before we jump into the Springbuck content, I just wanted to mention that we have been doing a lot of research here at the Conference Board on this topic of COVID-19. Particularly, we actually just published this week the first report that you see there on the left, from immediate responses to planning for the reimagined workplace. We actually surveyed over 150 HR executives here in the U.S. and have just published their results. I think you'll find those interesting. A couple teaser highlights. One is that we think remote work may be the lasting legacy of COVID-19, or at least one of them in terms of the work. And then the other is that while many organizations have already conducted workforce cost reductions, there are still more to come. So a couple teasers there. On the right-hand side of the screen, you can see Through a Glass Darkly, preparing to return to the reimagined workplace. We also know that many organizations are starting to think about returning to the workplace. And so we have both a report and a planner that's in Excel. And you can see there a small, don't expect you to read it, but it's an Excel, it's a screenshot of an Excel page, which is a planner and could help your team as they start to think about returning to the workplace and just to make sure they think of everything. There's many, many more human capital reports, and at the end of this webcast, we'll actually share with you the Conference Board's webcast hub the Conference Board's hub for COVID-19 content. So with that, I'm going to turn it over to Rod. Rod, welcome.
All right, thanks, Robin, and thank you, everyone, for joining us today. You know, organizations talk about mission a lot. And looking at our audience, I know this is a focus for most of you, and it drives you. At Springbuck, our mission is to prevent disease with data. It's universally applicable for every human being and matters during times of economic prosperity or uncertainty like we're in. What we do, why we do it, and how we do it needs to align with our mission. It dictates the products that we build, it dictates who we hire, and how we think about the industry. And as the team knows, we're absolutely relentless about achieving it. We're excited to have this call today because employers sit at this unique spot in the healthcare ecosystem. They are the most aligned entity with you and I as consumers or as human beings. When we're sick, they're penalized. When we're healthy, they're rewarded. And that makes this opportunity really, really unique and special. As we think about health intelligence, our focus is the employer and delivering to the employer the right health intelligence to empower you to move forward with confidence. The last thing you need is to be able to, or is to be forced to make decisions and do it without much information and with little confidence because you don't have good data to support you. We're currently equipping thousands of organizations on their own journey to prevent disease with data. And what health intelligence does is it aids in making proactive decisions that are data informed, helping organizations be guided with agility and success in near real time because of the data. One way that we have focused on this area for employers and specifically around COVID is to help with thinking about the responses of our product team. And so we're excited that several weeks ago we launched a brand new tool that we call Answers. And this tool set is fascinating. Of course, you'd expect me to say that, but it's a combination of machine learning and NLP designed to be able to take that question that you may often get while watching a webinar or talking to a coworker, and you say, hey, I wonder how many of something is going on within our population. Traditional data tools would force you to go spend time. We've actually curated this in a way that you can type the question, use your linguistic nature, which we've all been trained to do with Amazon and Google and others, and instantly be able to get an answer. Very exciting. Obviously, we'd ask that you come check it out and see what we're doing there. There we go, moving forward with the slides. So our team is powered by a team of data scientists, clinicians, and we're leveraging our health intelligence platform today to share some of our own insights with you. We've also made our entire webinar content on COVID available for free, and we're also supporting customers with questions like how is this going to affect my risk profile, risk change reports, specific COVID reports. There's a litany of various things that we're doing specific to COVID and then beyond. You can visit us on our website at springbuck.com, visit the resources tab, and download the webinars. This is, I think, part 6 for us on webinars that we're doing around COVID, and we're always looking to take our knowledge and pass it back to the community, especially during this time. There we go. Clicking through. So the global pandemic of COVID has touched all aspects of our lives, and there's no doubt that there's plenty of downstream impact that we're seeing already and much more to come in the future. So looking at recent data and trends, one thing that's been very evident is that there is an effect on the delay of healthcare. There's been decreased engagement in health activities, gyms being closed, there's population changes that organizations are making, and there's other changes that may trigger what we think are 5 key events that could have a huge impact on your benefit plan and the self-funded organization or plan that you're running today. Not just into 2020, but beyond. And today's session is really designed to address these areas. And what I'd like to just do before we do that is this. I saw this quote in the Washington Post on May 13th that said, from this doctor, "We were flying blind," he said. "There's nothing more disturbing for me as a doctor." Where that's applicable to us as employers, and specifically for folks that are in the data space, is that the data that we have coming in now was from all of this experimentation that was taking place by doctors. So to lean on that data, to use it for prediction or even for much analysis, is a bit skeptical, because you have to understand there was a lot of experimentation, a lot of things that were taking place. The other thing that took place here was that it wasn't until mid-March that we got our first CPT code even related to COVID. So just putting that into the level set there as kind of the first thing that we think about. The second thing I love about this quote is the word "were." What's unique and awesome about where we're at right now is that we have a nation full of amazing doctors and hospitals and physicians, and the word "were" intimates that it was in the past. So there has been a lot of culmination around what is working. Doctors have been sharing across the country, and there is good data now coming out. And fortunately, we're starting to get ahead of this virus. States are starting to open up. And so now we have to start thinking about what are those downstream effects that could affect us as employers. And that's what we're going to delve into today. So let me walk through the 5 potential shifts that we need to be anticipating as employers. The first one is this idea of unpredictable cost, which we're going to go into. Dr. Young is going to spend some time talking about these first several ones. Next one is adverse health consequences of delayed care. Logical to us, but how will this actually affect our plan? Increased rates of mental health conditions, and we're seeing that play out in the broader landscape today with just all of the chaos that we're seeing and the anxiety that's been built up, much because of just having to work from home and not being able to socialize. And then Dennis is going to talk through changes to your population and how we need to be thinking about that. And then most importantly, lastly, we'll talk about this fear of return to work and how do we keep loyalty as something that we're all obviously very passionate about as employers, creating a good culture and keeping our folks loyal and engaged as a workforce. So at this point, what I'd like to do is I'm going to turn it over to Dr. Young, and she's going to delve into these first 5 points. Dr. Young.
Yeah, thank you. So the first of the downstream impacts I'd like to discuss is the impact of COVID-19 on healthcare costs. So think back for a second to last March when COVID-19, we first saw that it was spreading throughout the United States. I think at that time, most people thought that the costs for healthcare would skyrocket due to costs of taking care of individuals with COVID-19. What we didn't anticipate at that time was the tremendous decline in utilization of services by individuals who did not have COVID-19. These decreases, some of them were due to fear, some of them were due to regulations and policies that were put in place, but the decreases in utilization were pretty much across the board, affecting everything from inpatient stays to ER visits to outpatient visits. There's still quite a bit of uncertainty as to what will happen to healthcare costs in general by the end of 2020. There are a number of reasons why we still have a great deal of uncertainty. Some of that uncertainty is due to not really fully understanding the trajectory of the COVID-19 virus. And by that I mean we really don't know if we will have one wave, we'll have multiple waves, if we'll have a wave that just sort of moves to different parts of the United States, and ultimately how many people will end up being infected. A second factor that will really influence total health care costs this year has to do with the delayed care. We don't know how much of that may never occur and how much will be rescheduled and over what period of time. Not too surprisingly, forecasts related to healthcare costs for this year have evolved over time. If we look at forecasts from Willis Towers Watson for self-insured employers, back in March, they were predicting an increase in healthcare costs pretty much across the board, anywhere from 1% to 7%. But by the beginning of May, those forecasts had changed so that employers who have employees mainly in areas that have had low infection rates may actually see a decrease in healthcare costs due to COVID this year. And even the highest increase is now down from 7% to 3% in areas that have higher infection rates. At Springbuk, we've built a framework to help us think through the impact of COVID-19 on healthcare spending and utilization. You can see on this chart here that the framework contains a pre-pandemic period before COVID-19 or the previous normal. Then there's the disruption period, which we're currently in which we're facing COVID-19, and eventually we'll reach a new normal down the road. So if you think about before COVID-19, we had more predictable demand and pricing to help us understand healthcare costs and forecast future healthcare costs. But the onset of COVID-19 has brought a great deal of uncertainty. First of all, we really don't know how long we're going to be in this period of disruption. As mentioned earlier, we don't know how many waves we'll have, and if we have future waves, will they be the same or will they be possibly less disruptive than the first one? We also don't know to what degree various delayed care will be rescheduled and over what time frame. But we believe that eventually we'll reach what we call an immunity point, which will be reached probably through having enough people who've been exposed to COVID-19 and possibly a vaccination. At that point, we believe that we will reach a new normal. So what we'll see in healthcare costs and utilization will not be exactly like what we saw prior to COVID-19. A pretty straightforward example is that we know that the use of telehealth has increased dramatically. A lot of people have found that they actually like getting their care that way, and so we expect that to continue. So we've also realized that part of the challenge of understanding the overall spending trend is that there are so many micro trends playing out beneath it. And these trends are playing out over different time frames. They have different magnitudes. Some of them will cause increase in healthcare spending, others will cause decreases. So what exactly is a microtrend? The first characteristic of a microtrend is the type of care. For instance, are we talking about elective surgery or are we talking about preventive care? The second characteristic of a microtrend is what is the population segment that we're talking about? Are we talking about children, adults? Are we talking about healthy individuals or individuals with a number of comorbid conditions? And finally, a third characteristic is external drivers. So you can think here of geographic regions as being external drivers due to different regulations that you may see in different states and different incidence rates of the virus. To bring home this idea a little further about microtrends, I'm just going to talk about one of them briefly, which is elective procedures. We think that's really one of the key microtrends as we look at the impact of COVID-19. I'm going to start off by saying that I think elective procedures is a bit of a misnomer because the term generally refers to any type of procedure that can be planned in advance. Elective procedure does not imply that the procedure is optional. It can definitely be time sensitive. We know that elective procedures, the volumes have gone down tremendously over the last few months. This has largely been due to regulations and policies put in place to preserve resources for COVID-19 patients. But what we're not sure about is as these procedures resume, how many individuals might decide to cancel their procedures. There will be individuals who realize they're feeling better now and they don't want the procedure. And there will also be individuals who are fearful of having a procedure at this time. In terms of what period of time resumption of procedures will play out over, that's often a little more challenging to answer. We know that there are resource constraints, so it's unlikely that pent-up demand for these procedures will be met in a matter of days or weeks. But we really don't know if it's going to play out over the remainder of the year or go into next year. We also expect that different types of procedures will actually pick up at different speeds. The next downstream impact I'd like to discuss is adverse health consequences of delayed care. So with all of these decreases in visits and elective surgery and emergent care, we have to consider how all these delays will ultimately impact the health of individuals and our populations. We know that the magnitude of this problem is quite large. In a recent Kaiser Foundation survey, 48% of survey respondents indicated that they or a family member had skipped or delayed medical care in the last 3 months due to COVID-19. One of the areas that this has affected is preventive care, everything from childhood vaccinations to cancer screening to general wellness visits. What are the potential effects from this? Well, if you think about the vaccinations, something like measles requires about 95% of the population to be immune or vaccinated in order to prevent the spread of it. So it's possible that we may start seeing some outbreaks of diseases like that. In terms of cancer screening, you can imagine that there are individuals who, due to the delay, will ultimately be diagnosed with cancer, and it will be at a later stage than it would have been without the delay. We're also seeing delays in care related to identification and monitoring of chronic conditions. So these are conditions like diabetes, hypertension, asthma, hyperlipidemia. By not monitoring these diseases, the concern is that there will be increased exacerbations of the diseases and possibly greater progression. Another issue is that when these diseases are not well controlled, if an individual should get COVID-19, the potential of a serious outcome becomes greater. Being able to look at data on gaps in care within your population will help you understand which evidence-based guidelines are or are not being met, and whether you're seeing a significant difference from the pre-COVID period. In the first slide of the presentation, I mentioned that ER visits were down by about 50%. Some of this is due to a decrease in injuries as people have stayed at home due to lockdowns. If the rest of it were due to low acuity care moving away from the ER or people trying to use telehealth where possible, this might actually be positive. Unfortunately, some of what we're seeing appears to be due to a decrease for serious acute conditions, including heart attacks, stroke, and appendicitis. These types of conditions have better outcomes when treated early in the event. And although no one knows for sure, the speculation is that some people are staying at home out of fear. We've also seen decreases or delays in cancer care including surgical interventions, chemotherapy, radiation therapy, and lab and imaging tests that might be used for monitoring. Here again, we expect that some individuals will be negatively impacted by this delay due to progression of the disease during this time. So what can we do to mitigate potential adverse consequences of delayed care? One step, as I mentioned earlier, is to identify gaps in care and identify individuals for outreach. You can leverage programs you already have in place with focus on outreach to patients who have gaps in care that are the most time sensitive or that are most likely to result in a serious outcome. It's also a good moment to think about your preventive care and wellness programs. Individuals have a heightened interest at the moment in health, so may be very interested in what they can do to stay healthier. Finally, I would recommend communication related to some of the more serious acute conditions that I discussed related to ER. It's a good time to remind people of symptoms of some of these types of acute events, as well as to educate people on what providers and hospitals are doing to help keep them safe. There's a link at the bottom here with some information that may be helpful in regard to these issues. The third downstream impact I'd like to discuss is the expected impact of COVID-19 on mental health conditions. Prior to COVID-19, statistics in the U.S. indicated that 1 in 5 U.S. adults experience a mental illness each year. We know that having a mental illness typically causes increases in healthcare spending for those individuals, and of course, not unexpectedly decreased productivity in the workplace. So our expectations for a number of reasons have been that mental health issues will increase related to COVID-19. Part of this is based on information we have from past outbreaks of SARS and Ebola, but we're also starting to see information related to this pandemic that makes us think that mental health issues are increasing. A survey from the Kaiser Foundation found that close to 40% of individuals feel that the pandemic has caused negative impact on their mental health. Additionally, we have statistics like just a huge increase in calls to a national substance abuse and mental health helpline. Interestingly, there have also been an increase in primary care visits for kids with an ADHD diagnosis, probably reflecting to some degree the stress that parents are feeling as the schools have closed and they're more responsible for the distance learning. So when you think about the mental health of the employees and their families, of course, COVID-19 will not affect everyone in the same way. We think one of the ways to look at this is to segment the population based on various factors. Some of those factors are listed here. As an example, if you think about employment, someone who has lost their job or been furloughed or feels that they're at risk of losing their job is going to have a different mental health issues potentially than others. We also know that certain jobs put people at higher risk, particularly healthcare workers on the front lines and essential workers. At Springbuck, we think that the ability to segment or filter to look at different parts of the population is critical. And in fact, we have a feature in our product shown here to the right so that populations can be segmented easily. Here you see an example where we're looking at geography. Again, I think geography is very relevant to mental health due to some areas having stricter lockdowns or having a higher incidence rate of COVID-19. So it's not enough just to have good mental health benefits. I really like this quote in the Harvard Business Review. Regardless of how robust a company's benefits are, it is culture that ultimately reduces stigma and empowers employees to actually use those benefits without fear of retribution. So it really needs to be a top-down approach from senior executives to managers, leading with empathy. Managers may need additional training in this area. It's also a good time to remind employees of what they have in terms of mental health benefits and any additional types of programs that you may have in place to help with the current stress, either an online or on-site stress management program or possibly something related to mindfulness, meditation, and so on. With that, I'd like to hand over the presentation to Dennis Schuler.
Great. Excuse me. Thank you, Janet. Good afternoon, everyone. I'm going to cover the next two sections devoted to changes you might expect to your population, and then really then dive into some of the fear that this coronavirus has kind of invaded into the psychology of people in terms of their return back to work, and then talk much more in depth about what you can be doing to develop and strengthen the relationship that you have with your employee base. So listen, you know, I work in private equity today. I've been a 4-time CHRO before, so I kind of feel the pain, and I right now work across about 35 companies. And I would consider the last 3 months to be, I call it the 4 U's: unexpected, unprecedented, uncertain, unbelievable. I could think of something else, but I don't think the conference board would permit me. But we have never experienced this in our past. And as a backdrop to the population changes that your organizations likely might see, listen, the economic downturn has forced organizations to lay off massive amounts of people. Just to give you a couple examples, in the portfolio I manage, we have 2 companies that were having record years. In fact, one of the CEOs was going to go on vacation for a month. He says, my results are so good, I cannot believe it. 3 weeks later, he's laying off 96% of his population. We have a healthcare company, similarly, been a record year. 3 weeks later, laying off almost 90% of the population. So companies have gone from a record-setting performance to, you know, from feast to famine overnight. And that's very disorienting to the employee population for lots of reasons. It shows up as 14.7% unemployment rate. You'd expect that number to be north of 20% in May. That's 36 million people that are out of work at the moment. And pre-COVID, 40% of Americans would have had a hard time raising $400 to cover an unexpected expense. So there's a huge amount of stress that's pervading the current situation. So you should expect, if you're thinking about your benefits enrollment, you should expect some unexpected increase in membership. As people are dislocated, think about the traditional nuclear family or the people that are working together raising their families. They might have been laid off or furloughed from one of their companies. They may show up in yours. So the net effect is you're going to see more volatility in the membership of your organization's benefits. So you got to keep an eye on that. The third thing is your population may change and it might not be temporary. Again, most of the companies I've been part of, and I'm sure you planned through the same thing, went with furloughs first so that you can keep people on your benefits program. We tried to avoid going to layoffs the best we could, but we've also done reduced work hours and we've reduced pay. And I suspect that'll be a way of life going forward. The direction I've given many of our companies is that if all you do when we come back post-COVID is to implement the same organization structure and the same headcount that you haven't done your business. Because I think it illuminates for us how we might be able to run our businesses in the future. Most companies, I think, will continue to have some form of shared sacrifice because I think people will demand that. The crisis has highlighted the importance and value of the front line. You see that covered very extensively on the news each night. I think it's a substantial shift that's going on in the United States about the unseen worker is actually the frontline worker that have kept us healthy and safe. Now, whether this holds true in the future is an open question, but I think that'll result, at least in short term, in increases in wages, likely benefits, and likely unionization efforts, or all of the above. So the net of it, those enrollment levels are going to be highly dynamic, whether that comes from additional layoffs or even mass onboarding as businesses return to work. Just to give you some examples, and I can't see where you folks are working at today, but I'm living here in Cincinnati. Kroger's adding 50,000 people. Amazon, 170,000 people. CVS, a pharmacy, 32,000. And I could go on and on. Instacart, 300,000 contractors. So it's a highly volatile enrollment level that you're going to need to manage through over the next several months. So that's the section on changes to population. I want to now turn attention to the fear of returning to work and how do you improve employee loyalty when you've gone through such significant dislocations. And again, I would think that one of the aspects that Janet hit was that there's a huge amount of fear in terms of, as I return to work, am I going to be safe? And so I think employees are going to necessarily hold us accountable to a much higher standard on health. It's front and center, and it's top of mind. And here are the fears. There's an evolving lack of understanding of the virus. You thought when it first hit, I was flying to Europe. The president was on the TV saying, hey, well, we only had 37 cases. They're going to disappear in a few weeks. 10 days later, my wife was calling me overnight saying, you better get on the next plane out of Europe because the border's going to be closed. That's how fast this thing moved. Secondly, there's a fundamental fear of contracting illness yourself, but I think many of you are like me, have other coworkers that you're cognizant of. And specifically for me, I've got a type 1 diabetic. So I worry not only about myself getting ill, but then passing it on to somebody who's got a pre-existing condition. And then there's some inherent tension today based on personal rights versus that of company policies. Think about masks for a minute and some of the tension that's going on there. All this is kind of a cauldron that's boiling, saying you better be on top of when you're returning to work, satisfying people's basic needs of, am I going to be safe in this work site? That's going to be job one, and it's going to be a priority. Now, the other thing I wanted to talk about was how do you maintain and improve employee loyalty while we go through this very uncertain time? And again, I would think that most of us would know this, but uncertain times demand heightened communication. So you need to be communicating early and often. You ought to be telling people what you know. You also ought to be telling them what you don't know. And you need to determine methodologies to stay connected and encourage two-way dialogue. For example, we've used pulse surveys. Quick survey monkeys, we drop into 15 of our companies that are going through the most dramatic changes. And people, frankly, are stunned. They're actually asking them for their input. We're asking questions like, do you understand the actions we took? Are you supportive of those actions? Do they feel like they were fair? Do you have confidence in the leadership? Is the level of communication appropriate? And that's opened up a whole two-way dialogue around, hey, as I come back to work, here's some things you, Mr. or Mrs. Employer, can do for me to make sure that you're taking advantage of my input as I return to work. So the net of it is treat those displaced with utmost care and respect, because those that haven't look through that lens, and that's a marker on the culture. If you've done a good job displacing people in terms of care and patience and understanding and empathy, and you've been in touch and you remain in touch and you're interested in leveraging their input as you return them to work, that's a cultural positive marker for your organization that you should leverage. The other thing is you should be thinking about looking at your best people who have the most options and performing retention or stay discussions. Again, I just was on the phone this morning with 2 of the search firms, and over the last week, the market's picked up dramatically in terms of people being responsive to phone calls. So you got to be on top of that. And the last thing is use the crisis in a positive way to drive home the importance of health. Janet talked about that. It is front and center now. It's on top of people's minds. So take advantage of it. If you haven't been able to get people interested in screenings and interested in their health, now's the time to double down on that, because that's top of mind for our people. The last thing I want to leave you with is a quote, which I found, which I thought was really interesting. It's nothing more important, nothing more urgent during this period of great uncertainty than the need for frequent, focused, and transparent communication. One done well, it moves the relation between the employer and employee from that of a transaction to one of shared commitment, and that's essential for accelerated business recovery. With that, I'll turn it over to Rod.
Okay, so now what? Obviously, COVID's got us all excited in an interesting way. We're all attuned to our health in a much more interesting way, I think, is probably the best way to think about it. My mother is at one of the highest risk categories, and I remember my brother and I sitting down with her with tears running down our faces and hers, saying, "Mom, you can't go to work." And having that discussion just with her to say you have to, and she was working in a small daycare 3 or 4 hours a week, so not much, but and just that fear that comes across and the anxiety of having that discussion, or ultimately she did end up staying home. So what are our takeaways from today? We have quite a few that I'm going to walk through that are what we would call specific action items that you can walk away and potentially implement in your organization today, whether or not you use us or not. That's really our goal. So the first one here is this idea of identifying gaps in care. Dr. Young talked about this, how this delay of care is exasperating those dealing with an already diagnosed chronic condition. We have these potential of folks that were either postponing cancer screening, or even those that had cancer and are postponing treatment. And so some of the biggest concerns from an actuarial and clinical perspective are all of these potential blow-up cases that are just a little bit unknown right now. What we do know, though, is that, and we expect, is that there will be a huge spike in gaps in care overall, logically, because people are just avoiding care. And so within your platform, whatever tool you're using, you should be able to identify those members that have a gap in care. It's very simple to do broad communication in a HIPAA-compliant fashion. If you're working with a third party that has the ability to identify the members at the member level, they then can see that gap in care and do more proactive research. One thing that Dr. Young mentioned was this idea that we are seeing some uptick in telehealth. One thing that we've seen in some of the studies and some of the data coming in is that although there has been an uptick in telehealth, it's only making up for about 50%, depending on which study you read, of the overall missed visits. So there's still a lot of opportunity for us to engage, support, and there's even some chat going on right now about how we help our teams recognize that there are outlets like an EAP available within our workforce or as a plan. So the gaps in care is just something that we think pretty highly we need to be focused on. The next idea is this plan for potential cost surges. And we've gone back and forth on this with our actuarial team, our data science team. We put a lot of thought to this. And one of the things that I mentioned earlier is this idea that early on, not only do we not have a CPT associated with COVID, we also had all of this experimentation going on. So logically, if you've got a ton of experimentation and you don't have a CPT code, a lot of what's been put out early on was guessing. And I don't like to make recommendations for any of our customers based off of guessing. We like to use sound data, sound advice, and have as much data as possible to point in the right direction. Otherwise, we're just we would caution that we're maybe potentially making steps too fast, and we're going to have to revert. And zigging and zagging is just not a really good way to lead. So just be cautious that there could be surges. Make sure you're using the right data to get you there. The next here is this idea of monitoring your data in real time. As we went from running with chaos and exploring treatment to now kind of coalescing around better ideas around how to treat, we think there's really opportunity to explore the data in much more real time. Seeing as that data is coming in, as it's becoming more consistent, we can make better predictions, we can act then upon it, and as we know, this is the summertime, as we were talking earlier. I'm in Indianapolis, Dennis is in Cincinnati, Robin's in Chicago. It's going to be in the high 80s and 90s. Summer is upon us. But what that means is that we all in this world, we take a little bit of a break, and then over our summer, we're finalizing, or hopefully finalizing, our plan changes for 2021, and we're putting those into place. So we know now is the time to be digging into the data and trying to make as much decisions as possible. The third one on here, or fourth one on here, is this idea of communicating consistently. And I've been on several of these calls across the country, and one thing I hear consistently is this idea that we have to communicate consistently. When we at Springbuck, we've got about 130 or so people, when we decided to do remote, which was on March 16th, we decided to do twice a week town halls. Twice a week. So twice a week I was doing this. So I've gotten used to staring at a green light on this square box called a laptop. And eventually the team said, all right, Rod, we think we're seeing you too much. So we backed off and moved to a once a week town hall. And we think that that's kind of a good balance when you're figuring out, when your team is saying, we're getting it, we're hearing from you enough. It's really difficult to over communicate during this time of direction, what things that you might have going on. But obviously you have to balance that with your culture and what you're trying to accomplish. And lastly here is this idea that we're preparing for increased workloads. So like most of us here, I'm working from home, I'm staring out from above my garage, and I can see every time an Amazon delivery guy comes and my dog decides to bark just as I'm entering a phone call. And the whole change here in our work effort, getting up and working from home, lots of questions around real estate footprint that employers are trying to answer. Dennis mentioned this about, will companies go from furlough to actual layoffs to terminations, and the impact that that's going to have on those that are left. We do expect, and from what we're hearing in the space, that a lot of organizations are considering, do we maintain more of a status quo and put more work burden on employees? That will then exacerbate, to use that word again, the whole mental health issue that we've already talked about. So there's a lot, obviously, that's going on. The one thing that we'd say is you need tools to be able to help you during this time that not just give you access to data, but ones that point you in the right direction. And hopefully what you're seeing from us or hearing from us is that that's our goal. Our goal is not just to build out a better data warehouse or collect a bunch of information, but to use curated knowledge to be able to point in the right direction with a health intelligence platform. So at this point, I think what we're going to do is we're going to go through some Q&A. There are some folks that have put some questions in the chat. If you've got questions, post some there. I'm going to start pointing to folks to be able to answer some of those. We've got Robin joining us back from the conference board. I'll put in a plug for the conference board so Robin doesn't have to, but she can mention this though. But the conference board's done a ton of research on this topic around mental health and others, and they've got great resources available on these various things. So I'm sure you'll want to say something there, Robin, but maybe we can answer the first question. There was this discussion around EAPs and whether or not the data that we were presenting from the substance abuse organizations was real or predicted. And I'll answer that one. I did in chat, but I'll just answer that here on the call. That 891% increase is an actual data. It's not a predicted, it's an actual number. And I remember when Dr. Young and I were doing some of this prep work, we saw that number, and it kind of floored both of us that that it would be so high. So that was one answer, but maybe Dr. Young or Dennis or Robin, the EAP question, there's often been this negative stigma around an EAP and how you get people engaged in it. What are you seeing from a data perspective, or any advice that any of you have around how to get EAPs utilized better?
I guess I can feel that one, Rod. It doesn't surprise me off the top of my head that there's a flat rate of usage. It's a program that often people don't take advantage of, at least in my background and experience, because they don't understand the full range of the services an EAP provider can provide. And specifically, the things that I think are on top of mind is not just the mental health and stress, but the financial planning aspects. And most EAP designs have an ability to sit down with a financial planner and kind of lay out what your income and outflow is going to be able to manage that in a much more proactive way, which actually reduces the stress. So I think if you've got flat rates, it's probably worth amping up the PR behind it. You understand in terms of the full range of the benefit offer. So I think most people see it as, well, someplace I go when I have a mental illness, and as Janet presented, there's still a stigma associated with that. But there's other aspects of it that the EAP program can provide if you have a well-rounded provider providing that benefit.
Good.
I would just add that we are here at the conference board, we are hearing that more organizations' EAP programs are being used. But we also think that it's really important to make sure that everyone in your organization knows that they are available and that they will not be, that they're basically anonymous. I think that because of the stigma, that there's concern that, a list of people who are utilizing the EAPs are being sent to HR or the CEO or other business leaders, and that's just simply not the case. I also think that organizations are starting to realize that there's going to be a lot of mental health and well-being concerns coming out of this pandemic, and how could there not be? And so it might be time to do an audit of the resources that you have available, your mental health benefits, and just to start to think about what you might have, because the military has had to think a lot about PTSD over the years. I think there's going to be a lot of PTSD coming out, especially in those organizations with frontline workers, but also with people who have lost someone or who have been at risk or who have just been traumatized by what's been happening.
Okay, good. Again, if you've got questions, post them in the chat function there within the Adobe platform. One of the comments that we wanted to mention here is that Springbuck is here to help. You hear often that we're all in this together, but we sincerely mean that. If we can be of assistance, whether or not you're a customer of ours or not, if you've got a question, again, we work with over 3,000 employers nationally and of all sizes, and we know everyone's a unique snowflake, and that, from a data perspective, is true. And so the question that you may have, if you'd like, submit the question to us. We're happy to answer that offline, do a free call, bring in the appropriate people to help you out. That's just who we are as a company. So. Robin, I think the questions are done. We're almost at our time. We hit our 50-minute mark, so everyone gets HR credit. So we did that. Any questions for you, or we're going to just turn it back over to you now?
That's fine. We do want to just mention a few upcoming webcasts. You can see here that we have some others coming up, and you're welcome to register for any of those. I also wanted to mention that we have a COVID-19 hub for the conference board, and on this page there's actually a banner that says, if you're interested in human capital content, click here. And so as Rod very kindly mentioned, we have done a lot of research, and in fact some of the topics that came up during today's call that I think you would find, if you're interested in those topics, that you'd find more research on that helpful, Things like supporting employee well-being and mental health with suggestions on what organizations can do. Compensation and benefit strategies to help employees navigate the new challenges. Many organizations are having to create new policies in order to deal with work from home and all of the other things. And so you might find that helpful. In terms of what Dennis said about communicating consistently, we have a report called How Leaders Can Connect with Employees in a Crisis. And then last but definitely not least, we have one on focusing on employee engagement in a crisis. And the actions that your organization takes now will be remembered. They will be used, when people talk about your organization, when employees talk about your organization, and also for future hires. So just suggest that you take a look at all of that. And the report that we mentioned at the very beginning that we had just published with the survey results, we added it to the download files. Since someone had mentioned they had a problem finding the report, that's a PDF, and you can just go to the download files here and find that new report that was just released this week. So just one more slide from us. Just want to let you know we have a podcast series called Human Capital Insights, and we're finding that a lot of people are interested in our podcast, and so we've been trying to take our research and then turn it into podcasts. So we're trying to put a new one up almost every week. So we hope you'll take a look for those. And then if you're interested in sponsoring a webcast, you can let us know. We want to thank you very much for joining our show today. And I'd like to thank Rod and Dennis and Janet. Thank you again for your presentation and for your insights. And finally, we value your feedback. So to help us with our webcast programming, we'd appreciate it if you'd respond to our webcast survey. Thanks so much and have a wonderful day.